Hi, my name is Chris Winterroad. I work for the New Mexico Aging and Long-Term Service Department State Health Insurance Assistance Program, and I'm here today to talk to you about a very important issue for New Mexico seniors and their families: depression and suicide in older adults. We're going to talk about New Mexico in general, but also Colfax County in particular. In Colfax County, among adults 60 years and older, 13% experienced poor mental health for at least half of the previous month. This is the fourth highest rate among New Mexico's counties. 18% of New Mexico seniors in Colfax County have doctor-diagnosed depression. This percentage is higher than the state rate of 17%. There is a little bit of good news. For New Mexicans 60 years and older, doctor-diagnosed depression percentages have decreased since 2011. It's kind of hard to tell why things went down in 2020 during the pandemic. It could be that fewer people were going to the doctor, but it is lower than in 2019. Between 2016 and 2020, suicide mortality for those 65 and older show that Colfax County has the 13th highest mortality rate among New Mexico counties. Clearly, this is an issue that is very significant for older adults in New Mexico, and we need to do what we can to help support them and to respond appropriately when people are showing signs of depression and suicidal tendencies. If you or someone you know is experiencing thoughts of suicide, please call one of the numbers below. The New Mexico Crisis Line is 1-855-662-7474. The U.S. National Suicide Prevention Lifeline is 1-800-273-8755. And there's a Spanish language suicide prevention line, Área Nacional de Prevención de Suicidio. It's 1-888-628-9564. That's 1-888-628-9564. And now my colleague Valerie has some very important information for you on how Medicare covers depression screenings.
Hi, my name is Valerie and I'm with the Aging and Disability Resource Center. Today I have some important information about depression. Depression can be an issue for New Mexico seniors. Medicare Part B covers an annual depression screening. The annual depression screening includes a questionnaire that you complete yourself or with the help of a doctor. The questionnaire is designed to indicate if you are at risk or have symptoms of depression. If your results show that you may be at risk of depression, your provider will perform a thorough assessment and will refer you for a follow-up mental health care if appropriate. Depression screening should be conducted by your primary care doctor or another trusted doctor to ensure that you are correctly diagnosed and treated. In most cases, you should receive your depression screening when you are scheduled for a doctor's visit, often during your annual wellness visit. However, you can also ask your provider to screen you during a separate visit. You do not need to show signs of symptoms of depression to qualify for a screening. However, the screening must take place in a primary care setting like a doctor's office. This means Medicare will not cover your screening if it takes place in an emergency room, skilled nursing facility, or a hospital. If you qualify, Original Medicare covers depression screenings at 100% of the Medicare approved amount when you receive the services from a participating provider. This means you pay nothing, no deductible, no coinsurance. Medicare Advantage plans are required to cover depression screenings without deductibles, co-payments, or co-insurances when you see an in-network doctor and meet Medicare eligibility requirements for the service. Finally, if you have thoughts of suicide or are concerned that someone you know may have those thoughts in the United States, you can call the National Suicide Preventive Lifeline at 800-273-8255 or go to speakingofsuicide.com/resources. Remember that depression screenings are a healthy and important part of everyone's preventative care. You can learn more about Medicare coverage of behavioral health by calling 1-800-432-2080. Thank you and have a good day.